Softball injuries in young athletes are on the rise and nearly as frequent as baseball injuries. Today, we are being joined by Dr. Britta Anderson, a sports medicine physician at the Detroit Medical Center, and she is also in her 11th season as an associate physician for the Detroit Tigers. Thank you for being here. Welcome. Dr.
Thanks for
Anderson is
having
going
me.
to answer some frequently asked questions about softball injuries, as she specializes in interventional procedures, injury prevention, treatment, and rehabilitation. Thank you so much again for joining us. We're so happy you're here.
Thank you.
So we'll just dive right in right now. So, what are some of the most common softball injuries you've seen?
Uh, you'd be surprised to see a large garden variety, primarily upper extremity issues, shoulder, elbow, but I've dealt with concussions, muscle strains, contusions, bruises, sprains of the knee and ankle. So really head to toe, anything's fair game with softball.
Yeah, definitely. And what are some ways that athletes can prevent these injuries? I know the list was long, but
I think if with softball in general, just like I guess any other sport, it's preseason, off season, in season prep. So obviously taking care of your body, keeping yourself mentally into the game. Also, just good diet, staying hydrated when you're in season, especially also with training, depending on the time of year. Good flexibility and core programs in the preseason and off season will, in a sense, help prevent some injuries. I think a good strength program is also important during season as well as off season. I think also just making sure you're practicing proper mechanics, whether it's fielding, batting, and everything in between, so you kind of prevent any unnecessary injury.
yeah, and you answered it a little bit here, but what are some non surgical treatments the DMC offers to treat sports injuries?
Yeah, we're lucky to have a large array of orthopedic and sports medicine specialists. Being a non-operative physician, obviously my job is to keep athletes out of the operating room if all possible.
Right.
We utilize physical therapy on a regular basis. So, initially when an athlete comes in with an injury, we have an array of diagnostic testing, physical examination, assessment, but very often we use our athletic trainers who are maybe participating with the high school teams directly or indirectly through physical therapy clinics. Physical therapists are definitely, I'd say on a daily, I write for that on a pretty common basis. We do non-operative splinting,
Yeah.
casting. We can do interventional procedures. I think, if it's an everyday weekend warrior or athletes that may be a little bit older and we have maybe some chronic issues or some degenerative issues, sometimes interventional injections such as cortisone can be helpful. But we also do regenerative procedures such as platelet-rich plasma injections for things like ligament sprains, tendinopathies, tendon tears, muscle strains, and such like that. So we do that. We have a couple osteopaths in our group where we can do some osteopathic manipulative therapy, some fascial treatments. So we do have a wide array of treatments. We even have a physician on staff that does acupuncture too. So.
Okay, yeah, really a wide range of everything going on.
Yeah.
And we spoke about it a little bit earlier, but you do deal with a lot of different athletes, and you are actually an athlete yourself. So, how does that help you relate to the athletes who come in and you treat?
I definitely think I wouldn't be here without all of my personal endeavors with injury. I grew up playing high school softball and soccer, and then I played college basketball at Wayne State. I've had a few knee surgeries in my day, so I think understanding the importance of just participating in sport, there's so much gain to it, and keeping athletes in for many reasons. So I can definitely understand the importance of getting patients back, getting athletes back to the playing field or court or whatever their sport of choice, but making sure that they do it safely. It can be sometimes intimidating coming into a doctor's office. You've already probably run a million different scenarios in your head, and also probably researched a lot online. So, between the parents and the athletes, I think there's a lot of, stress and anxiety. So I think being able to relate can kind of in some points, in some ways, be relieving to the athlete, and maybe gain a little bit more trust because we understand.
Yeah, definitely. And going off of that, when do you think is a good time for someone to see a sports medicine physician?
Yeah, I think really anytime you're in question, you don't feel comfortable, like maybe something's been slowly smoldering or bothering you, or you've had a very distinct injury that is limiting you. So really use pain as your guide. If you're unable to participate through training or practice, or something's in the back of your mind about an injury, something doesn't feel right, I think it's very reasonable to come in and be assessed by a professional. There's really no wrong time. I guess, if you're feeling uncertain, then you should come in and be assessed, just to make sure that things are safe. And many times patients come in, and we can treat them and get them back out pretty quick. And I've had patients kind of feel silly about coming in, but there's really no wrong time, and we encourage patients to do that just for their own personal safety and well-being.
Yeah, makes total sense. And like you said, you can relate to it too. So I'm sure that's very helpful for all the athletes who come through.
Yeah.
Well, thank you, Dr. Anderson, so much for joining us. Is there anything else you might want to add on that you think we might be missing, or anything important that you think should be mentioned?
I think it's good at this day and age, in the younger age groups, even through high school. A lot of athletes specialize in one sport. I think it's good to keep a garden variety and make sure that you just enjoy life in general, and make sure you find the fun in sports. Kids these days are training much harder than I did back when I was playing, and I think just making sure that you keep the fun in the game, and then also don't be afraid to try a variety of things, because as we get older, you kind of hold on to the variety, as I'm doing now. So definitely just have fun and be safe.
Yeah, fun and sports goes hand in hand, so we have to keep that alive. That's for sure. But
Yes.
thank you again so much for joining us. And the DMC is the official healthcare provider for the Detroit Red Wings. If you have a sports injury, go where the pros go, the orthopedic and sports medicine team at the Detroit Medical Center. To learn more, visit dmc.org/sports or call 1-888-300-DOCS, DOCS.